Karibuni sana. Welcome to everyone joining us today from Kansas, within the United States, and from Kenya. My name is Sarah Finicario Kessler, and I'm an associate professor in the Department of Family Medicine and Community Health here at the University of Kansas Medical Center. And we are honored to host the presentation today by His Excellency, the Deputy President, the Honorable William Samoei Ruto. Over the past decade, we have been developing collaborations between KU Medical Center and some of the finest institutions in Kenya to advance our shared goals of improving health outcomes and fostering bi-directional educational exchange. We have formalized Memorandum of Understanding with 6 institutions that I would like to briefly recognize. Our partner NGO in all of our research and educational efforts in Kenya is Global Health Innovations, or GHI. GHI was originally started in the United States, actually started in Kansas here, but it's now registered and operated from Nairobi, Kenya by the Executive Director, May Maloba, who leads our research staff, who are nearly 20 strong in number. We have also partnered for a long time with the Kenya Medical Research Institute, KEMRI, on multiple NIH-funded grants since 2013. And I want to appreciate the many colleagues and esteemed scientists from KEMRI who have joined us today. We also partner with Moi University. Our respective schools of nursing have collaborated to innovate together to develop online learning seminars during the COVID period that were focused on describing and sharing each country's response to COVID and challenges they were facing. We're also proud to collaborate with faculty at the University of Nairobi on NIH-funded grants, specifically focused on alternative delivery mechanisms for pediatric HIV medications. And we have signed an MOU with Kisii University and one with the government of Nandi County. We have a strong connection with Nandi County. Kapsabet Hospital was the first site for our pilot study in Kenya back in 2011. And over the years, it's sort of become our home away from home while we're in Kenya. Our research began with a focus on early infant diagnosis and the development of web-based interventions called the HIV Infant Tracking System, or HIT system. And based off of the strong efficacy data and the low cost of implementing this web-based system, the HIT system was recognized by NASCOP as a best practice for early infant diagnosis. Our work with the HIT system then expanded to try to intervene earlier with pregnant women living with HIV to support their retention through care. We've evolved the technology from the HIT system to face another health challenge that is really important right now in Kenya, and that's cancer. We've developed the cancer tracking system to support cervical cancer screening, same-day treatment of precancerous lesions, and extended follow-up for women who have been diagnosed with invasive cervical cancer. Our next pivot in our research was to address COVID when it hit us in 2020. And I just wanted to share the story that in 2020, we received some funding from the School of Medicine in Kansas, and we reached out to our partners in Kenya for help. Our team members at GHI and the computer programmer for the HIT system helped design a COVID tracking system that we used here in Kansas at our local health department in Wyandotte County. So it was a great way that in Kenya reached out to help us here. We've since adapted the system. Now it's being piloted at Kisumu County Hospital as a surveillance tool for tracking COVID in Kenya. So it has been a privilege to engage in this bi-directional learning and support across our countries. And despite this being a state institution in the middle of the United States, we have received strong support to pursue global health partnerships, which reflect the vision of many of our leaders here at KUMC. And I would like to personally thank and acknowledge the tremendous support from our Vice Chancellor for Academic and Student Affairs, Dr. Robert Klein. Dr. Klein has been steadfast in his support for our Office of International Programs and expanding global health partnerships, and encouraging me personally to pursue this work since my first days at KUMC. So Dr. Klein, thank you very much for being an advocate and champion for this work. And may I now turn it over to you to introduce our esteemed guest of honor.
Thank you for the very kind comments, Dr. Kessler. You're very deserving of of it. Good afternoon. I'm Robert Klein, Vice Chancellor for Academic and Student Affairs at the University of Kansas Medical Center. In my position, I oversee the academic activities of our University Medical Center. Included in my responsibilities is oversight of the Office of International Programs under the robust leadership of Kimberly Connolly, our Senior International Officer. One of the cornerstone concepts of the University of Kansas Medical Center is that faculty, staff, and learners across our 3 schools, health professions, nursing, and medicine, must have the opportunity to become personally and intellectually familiar with the people, ideas, and customs of other nations. One of our most important collaborations is through the groundbreaking research work. Dr. Kessler mentioned it with the HITS program in Kenya. Our relationship with Kenya is critical to our overall mission. We value the exchange of ideas and experiences between KU Med Center and the Kenyan medical community and look forward to growth of our Kenyan educational, medical, and research exchange programs, which benefit students and faculty on both sides of our partnership. It is my great pleasure to introduce our guest speaker. Dr. William Samoei Ruto is the first elected Deputy President of the Republic of Kenya and the leading presidential candidate in the August 2022 election. The Deputy President joined mainstream politics in 1997 after his election as a Member of Parliament for the Eldoret North constituency, where he served 2 terms. Dr. Ruto also served as Home Affairs Assistant Minister in 2002 and Chairman of the Parliamentary Select Committee on Constitutional Reform in the 9th Parliament, leading the process of setting up the team and structures that put Kenya on the road to a new constitution. He was appointed Minister of Agriculture in the coalition government that was formed in 2008, with his achievements billed as the modern yardstick of political performance in Kenya. Dr. Ruto later served as Minister of Higher Education, where he established student-first reforms of tertiary education systems and refocused government investment in vocational and technical training. In 2012, Dr. Ruto and President Uhuru Kenyatta formed the Jubilee Alliance on a platform of peace. The alliance brought together the United Republic Party, led by Dr. Ruto, and the National Alliance Party, led by Dr. President Kenyatta. For their second election bid in 2017, the alliance was registered as Jubilee Party and was re-elected on the strong delivery track record of his first term. William Ruto is now serving his second term as the Deputy President. Dr. Ruto holds a Bachelor of Science degree in Botany and Zoology, a Master's of Science in Plant Ecology, and a PhD in Plant Ecology from the University of Nairobi. Welcome, Dr. Ruto.
Thank you very much for those kind words and for making it possible for me to participate in this very important discussion about health, and more particularly about health insurance. I'm delighted that while away from home, it is possible for us to have this conversation. Thank you for the partnership between your great institution and our country. I have listened very carefully, and your relationship with distinguished institutions in our country, from Kenya Medical Research Institute to the Kisii University, Moi University, the various health facilities and hospitals in Kapsabet, Kisumu, and many other areas. It actually confirms your organization's international outreach that has given you the opportunity to work with partners across the globe. And from Kenya, we are truly grateful for your partnership. Having said that, and knowing very well that you have a good background about Kenya, what is engaging us as Kenyans, and especially those of us who are the privilege and honor to be leaders, is how we can create an inclusive society. It is stated that many families are just one sickness away from poverty. And that concerns every Kenyan, and especially those of us who have the opportunity to lead. And because of that, partnerships like the one you have discussed go a long way in building the necessary networks that will help us cushion millions of families in Kenya from the adverse effects of getting into difficulties, especially on matters to do with health. When we came, just give you a bit of background, when we came into office in 2013, the number of people who had health insurance were about 3.8 million. And every contributor was contributing 320 Kenya shillings. Now, we have since reviewed the contributions in terms of quantum, and we have also reviewed the services that are offered to on the basis of that insurance. And we have also increased the numbers. The numbers now are standing at close to 8 million contributors. And the contributions have been graduated, the least being 500 shillings a month, the most being 1,700 shillings a month. There is still largely a mismatch between what citizens get to pay and the quality of service they access and the accessibility of the services that are that one gets out of having being an insurance holder. And that is why going into the future, we are reimagining that whole health space, its delivery, the human resource components, the health infrastructure, and the whole array of quality and access. We believe that the most vulnerable people at the bottom of the pyramid sometimes bear the brunt and sometimes have to make difficult choices, whether to go to hospital or not. And if you are in a situation where you're sick and you don't know whether you're going to go to hospital or you wait, it's a very difficult decision. And that is why in 2017, we made universal health coverage delivery one of the election commitments that the government of Kenya made to its electorate. Significant steps have been made, albeit very slowly. The law that we were supposed to pass, for example, in 2017, 2018, was actually passed this year, 4 years late. But it's never too late to make the right decision. So now we have the law that will provide, give us the framework that will make it that much more easy and flexible for us to deliver UHC. The law now gives us latitude for a graduated contribution scale majority of the people at the bottom of the pyramid can now pay a little bit less. And the people at the top of the pyramid, including the person speaking to you here, will pay slightly more. That way, we should be able to accomplish a couple of things. Number one, it should be possible under the new arrangement to maybe double or triple resources available from contributions for the delivery of health. That will also help in improving the quality of personnel and training so that they can better deliver healthcare. The limitations on training, once we can put together additional resources, will actually guarantee better delivery from better qualified and better trained human capital. We also believe that this will pave way for us to improve the access of health facilities through making sure that we bring in the private sector to be a partner with the public sector on the hardware, the dispensaries and health centers and level 1, level 2, level 3 facilities that would largely help us with prevention. And we can actually substantially reduce the cost of delivery of health services if we make it that much possible to access at the earliest opportunity primary health care that is largely preventative. We believe also with this new trajectory, we can also improve the quality of facilities in terms of equipment, modern equipment that makes it that much more easy to deliver healthcare. I remember in the last 7 years, we have equipped 92 hospitals across the country with level 3 and level 4 equipment that would help these hospitals across the country to be able to provide the quality of service that will improve the delivery of our health packages. It is also our belief that with these additional resources, we can also cover more of indigents. Today, we are paying for close to 1.5 million Kenyans who cannot afford health insurance. The government of Kenya is paying. With additional resources, as we restructure the whole health financing, including the new contribution structure, we should be able to double the number of people that can be paid for health insurance by the government of Kenya. This is the bottom-up economic approach model that we are canvassing as we go into the elections this year. Because aside from health, we have job creation, we have making sure that there is access to credit, we have enhancing productivity in our agricultural sector and a myriad of other interventions that we believe can put Kenya on a sound footing, both as a stable nation, but also as a country that is not only prosperous, but shares prosperity across the board and leaves nobody behind. I am very confident and sure that the partnership between your great institution at Kansas and the institutions in Kenya will give us leverage to be able to share our ideas on how we can better deliver universal health coverage. And we are looking forward to listening to your input into our plan and looking at avenues and possibilities of us sharing experiences, especially your experience out of the interventions you have made in Kenya with the various hospitals and institutions of learning that you are working with. I will be happy to engage and to benefit from research and the ideas you may have on how to better deliver healthcare, make Kenya a much more healthy nation, and the globe that we all share a better place for all of us to live. Thank you.
Thank you so much, Deputy President Ruto, for your words and your thoughts today. Would you like us to take questions from the audience using chat, or maybe if you want to give a little guidance on how you'd like to have questions?
I can take some questions. I have no problem. Only that I'm constrained by time. I have an interview that I must attend, but I can take 2, 3, maybe few questions. I'd be happy to do that.
Thank you so much. I think we have a question in the chat, but I'd also like the opportunity for our colleague, Dr. Karaga, if he would like to help facilitate the questions.
Yes, thank you, thank you, Your Excellency. My name is Kenneth Karanja. I'm a Kenyan resident here in the United States and been following the good work that your government has been doing over time. And I have a question regarding your point and the fact that you have been interacting with Kenyans in the diaspora for the week you've been here. So most of us would like and have a desire to help in advancing the bottom-up approach to healthcare provision and democratizing the same. Which 2 or 3 concrete plans do you think you can put together to leverage these resources?
The people in diaspora form a very important cog in the development of our nation. Many of the people in diaspora already are helping us finance health for their families way back at home. So they are already making a contribution. What we can do going forward is to make sure that not only is health insurance affordable, but it is also accessible and it is of a quality that actually delivers the service. And an engagement with the diaspora. And just for good record, I will be engaging Kenyans here in Washington later this evening so that we can better understand how their contribution and their input can be made part of the whole push to have a better nation for all of us to share. So I will be having an engagement as part of this exercise. We have clear thoughts on how the private sector and how diaspora can participate in our universal health coverage and bottom-up economic model. And I will be sharing in detail this evening with my countrymen from Kenya later. And I hope, Kenneth, you will be part of that engagement.
Thank you for that answer. There's another question from our online attendees. One is concerning the fact that we have been contributing to the peace and security of our region, East Africa, by sending some of our troops to Somalia as part of the peacekeeping UN activities there. However, some of these have post-traumatic stress disorders. Is there any particular intervention that these veterans are getting in our hospitals that can also be expanded to the general population?
You're quite correct. We are seeing the emergence of prevalence of psychological challenges, and many people are it's a new area. Many people are beginning to be alive to the challenges that come with situations like the one we're engaged in Somalia, where many people get out of Somalia and they are affected and their health is in jeopardy. We are developing psychological support in many of our hospitals. We are working with different partners to ensure that we are working with as many partners as possible. We recently launched a facility for our military and security personnel, a whole new hospital that will have these many supportive areas. And this is a huge 700-bed facility that will not only be used by our men in the security sector, but will be available for other Kenyans and will have the necessary infrastructure and the necessary equipment to support people who need psychological attention.
Thank you. Do you have time for one or maybe two more questions?
One question, maybe.
All right, one last one. We won't keep you longer than that. We need to let you go. One last question. We appreciate the bottom-up approach, but even the bottom has another bottom. These are among the homeless and street families. How do you plan to engage this section of the population in provision of healthcare?
The whole space about the bottom is really a very interesting discussion. We are having a discussion like no other. When I listened to Joe Biden make his statement 2 days ago, he said a fundamental statement that trickle down never worked. And that's the conversation we started before in Kenya. And the bottom just means the bottom. It means even the street families, even the people living with disability, people who are marginalized, people who are in the fringes of development. And that's the whole new paradigm, that these people at the margins, marginalized, at the bottom of the pyramid, are crying for inclusivity. And it's not possible for us to continue the journey of development while we leave other people behind. So this is the whole concept why we think the bottom-up economic model will not only create inclusivity, but it will actually tap into a resource that at the moment many people think is a challenge, but we can actually turn it into an opportunity. Whether you are talking about the demographic dividend, the huge youth bulge, or you are talking about the people like the ones you've mentioned who are on the margins of society. So that whole space is our new approach. And we believe that they not only need to be included politically, but we should also have economic inclusion so that they can make a contribution to the economic well-being and progress of our nation. And we will be sharing in detail with my economic team later this evening with my good friends and fellow citizens from Kenya. And of course, it's going to be an open discussion because we all live in a global village. That's why we are having this discussion in America and not in Kenya.
Thank you very much. I'll give it over to Dean Akiwonton to give a vote of thanks. Appreciate your presence.
Thank you very much, sir.
Wow. Thank you very much, Your Excellency, Honorable Dr. William Ruto. I am originally from Nigeria, but I'm an adopted Kenyan. And you can see me in my regalia and even with my staff of office.
Yes.
Yes. So to Kenyans, I am known by my elder name, Elder Arap Kimaru, from the Kapsabet region.
Okay, wonderful.
And, you know, I visited Kenya in 2018 with our team from the University of Kansas Medical Center, and it was a pleasant experience. I visited Eldoret, and I saw Nandi, the home of champions. And
Eldoret is my hometown, by the way.
Yes, very nice place. We went to Kapsabet, and since then I've become a lover of tea. I drink a lot of tea now.
Wow.
So
Wow.
thank you very much for that.
Thank you.
Your speech is very inspiring. As an African, I have been opportuned to listen today to a leader who thinks about those who are at the bottom of the pyramid. And you used such terms that makes it obvious, that these are people who are dear to your heart. And your universal health program, your primary health care program, and your bottom-up approach are things that we need and that the people need. I think Kenyans, Africans, and people from developing countries should count themselves fortunate that someone like you is running for the position in later this year, and we sincerely wish you all the best. And you are a beacon of hope in Africa and in many countries around the world. I also want to thank you for acknowledging the many collaborations between Kenyan institutions and the University of Kansas Medical Center. I agree with you that such collaborations are very important in better training qualified human capital that will sustain the bottom-up approach and the universal health program. And we at the University of Kansas Medical Center remain very committed to collaborating with Kenyan institutions and with the Kenyan government to contribute our own little quota to your fantastic ideas and the plans you have for the people. And more importantly is also our opportunity to learn from you how you have been able to engage in some successful activities, because we definitely have rural areas in the United States that will benefit from such initiatives as well. So it's a mutual, collaborative, beneficial relationship between our institution and the government and the institutions of Kenya. We know that you are very busy, And I, on that note, want to say a big thank you to all those who have contributed to this event. And if, yes, their names on slide. So from your office, Dr. Abraham Singu, from the Kenya Diaspora Alliance, Dr. Kenny Karanja, Mr. Isaac Langat, Dr. Aquilas Muteti, Professor Daniel Sambu, Mr. Anwar Sadat, Mr. Samuel Cheraizi, and my very good friend, Honorable Ruth Kuch. At the University of Kansas Medical Center, one person who's always led our initiatives in Kenya, Dr. Sarah Kessler, and our head of the Office of International Program, Kimberly Connolly, ably assisted by Stacey Rader, Alexa Smith, and of course, a very big thanks to our Vice Chancellor for Academic and Student Affairs, Dr. Robert Klein, who opened up this meeting by introducing you, sir. And for all those who work behind the scenes, May Maloba and a lot of other people that I cannot mention. We are truly honored to be associated with you. We are glad that you found time out of your busy time to present to us today. We wish you all the very best, and we will continue to do our best to promote this relationship. Thank you very much, Your Excellency.
Thank you, my friend. And good luck to you as well.
Asante sana.
Asante sana.